perfect afternoon to everyone present here. I am Prerna Viswakarma, a second year MHLU student at Prasanna School of Public Health, MAHE, Manipal, India. It is my honor to welcome all the participants from 58 different countries to benefit from the 12th International Health Literacy Webinar organized by Manipal Health Literacy Unit, known as MHLU, in collaboration with the School of Public Health, University of Sydney, jointly organizing a free webinar on health literacy for all healthcare providers, researchers, policymakers, industry, academia, and the public. Before I invite the first speaker of today's webinar, I have some important requests for the participants to kindly mute their cell phones and the mic. You may post any queries or questions during the session through the chat box. We will be addressing a few selected questions considering the time limit. In today's webinar, we will hear insights from the experts on the use of artificial intelligence in improving health literacy and the effective health communication. Please note the speakers will be sharing their insights for 15 minutes. I am pleased to introduce our first esteemed speaker for today's webinar, Professor Dr. Dawn Nutbeam, a distinguished figure in health literacy. Dawn Nutbeam is the Executive Director of Sydney Health Partners and a Professor of Public Health at the University of Sydney. Sydney Health Partners is an accredited research translation center. Dawn Nutbeam's career has spanned senior leadership positions in universities, government, and health services. He also contributed to international organizations including WHO and the World Bank. He was formerly Vice-Chancellor of the University of Southampton, UK, Provost of the University of Sydney, and Head of Public Health for the UK government. He is a public health scientist with research interest in the social and behavioral determinants of health and development and evaluation of public health interventions. His current research focuses on developing and testing interventions to improve health literacy in different populations. Please join me in extending a warm virtual welcome to Professor Dr. Dawn Nutbeam. Over to you, sir.
Thank you very much for your kind words of introduction. I'm going to share my screen and we'll get started with the presentation. Okay, I'm hoping that you can see the screen. This afternoon, it's early evening for us here in Australia. I'm going to speak a little bit about the rapidly evolving landscape of artificial intelligence and its importance for health literacy. I'd have to start by saying, of course, you hear a great deal about artificial intelligence, and quite a lot of what we hear and read is human rather than artificially generated and not very intelligent frequently, and a lot of hype very often. What I'd like to do is sort of narrow our focus a bit to consider where we're at in the evolution of AI and its potential applications in health, and particularly in health communication. Yeah, can somebody go mute, please, because I can hear someone speaking in the background. AI, so the WHO definition of AI is the ability of algorithms, which are human created, encoded in technology, to learn from data so that they can perform automated tasks without every step in the process having to be programmed explicitly by a human. In other words, they have the ability to predict what next and to provide information on that basis. These algorithms are trained, is the language that's used, using very large data sets, typically data sets that are accessible through the internet and other sources. And as the machines gain more and more access to more and more information, they can learn from that additional information, and we often refer to that as machine learning. So using digital technology is not really new in health communication and in our efforts to improve health literacy in populations. The last 20 years in particular, we've, I think, made good use of different digital technologies, in particular to communicate directly with large numbers of people at relatively low cost in ways that historically have been very difficult using traditional and conventional media. As we've gained an experience in using these digital media, of course, we've developed skills in targeting and personalizing information in a very highly individualized way, and progressively learning to use these technologies to engage people interactively. People are providing information, we're reacting to that and providing new information. Again, can I ask that everybody mute, please? Somebody's talking in the background. Anyone know who that is? What we do know is that the COVID-19 pandemic significantly accelerated the use of digital technology for obvious reasons. People weren't able to interact face-to-face, and we used a lot of virtual healthcare during that period of time, and it also led to a rapid acceleration in the use of some of the sort of early phase AI supported technologies, particularly things like chatbots and a virtual assistant, who are capable of interacting in real time with humans and in using more or less natural language. And we've learned a lot through this period of acceleration. People have enthusiastically embraced the use of chatbots for a whole range of different purposes, well beyond COVID. And slowly, some evaluations have been done. As is often the case when you put something like this to the test, the results have really been very mixed and honestly quite hard to generalize. People who are comfortable interacting with digital platforms get the most from them. Generally, that's people who are younger and better educated. By and large, though, for a majority of people, it's been an unsatisfactory experience. And the human response to chatbots, however good they are, has been highly variable, with some very significant differences in levels of trust. Again, differences by cultural background, differences by age, differences by gender, have indicated that although chatbots are becoming quite sophisticated, at this point, they're not considered to be a desirable or highly trusted source of health information. Things may change, but right now, they're probably not as useful as we might think they might be. What we are also learning, though, is as we're getting some more sophisticated large language model platforms, things like ChatGPT that many of you will have heard of, Google Gemini, the same. Those of us interested in health communication are already beginning to use these technologies to produce communication materials in a wide variety of formats that are easy to understand and are capable of being targeted at different populations. These platforms can also translate into multiple languages very quickly. So if you, as I do, I work in a community with more than 50 languages, 10 dominant languages, but multiple languages we're trying to work in. This is really saving time and energy. And the work that's produced by ChatGPT, both in English, the original language, and in translated forms, isn't perfect, but it gets you 85 or 90% of the way to what you want to get to, and allows you, with a bit of human intervention, to develop communication materials that are highly targeted, easy to read, very accessible to multiple populations. And what we're learning is that as these large language model platforms get more training, get used to different formats, different requests, different types of requests, then they improve in the quality of output that they can provide. And we're also learning that you can fine-tune the source material from which they derive their responses in order to build trust and ensure greater clinical and scientific accuracy than is typically the case at the moment when these models are just simply gathering all sorts of information from across the internet. What we've also, well, this is more or less repeating what we know from good research that's being done at the moment. Some colleagues of mine here at the University of Sydney have been working with ChatGPT for quite a while now, is that they're finding that ChatGPT is providing consistently providing comprehensive and easy to use, easy to understand responses in very natural language, easy to relate to language, and that on average it can do a much better job faster at converting technical documents into easy to understand language than some of the technologies that we've used previously. And there's a paper that I've referred to there that you might find useful by way of follow-up to that. And this is an example that I actually ran this morning. I gave some very precise instructions: explain a heart attack using 150 words and using a language level that could be understood by a grade 7 student. And don't need to get into detail, but this is the kind of thing that ChatGPT would come up with. Now, I wouldn't use the language in quite the form that it uses it, but it gives me a really great start if I'm trying to develop a simple document that helped to explain at a language level that most people can understand what a heart attack was. So it's really fast, really helpful, uses natural language, and helps us to move things along very quickly in this kind of a way. Very practical example. I haven't used this slide, but I also asked it to translate it into 10 different languages, and I've spoken to colleagues who speak those languages, their native language. And again, the translations are good, accurate, but perhaps missing some of the cultural nuance that you might want from translated work. However, and I can't emphasize this strongly enough, it's early days at the moment, and the more we research and understand the strengths and weaknesses of platforms like ChatGPT, the more I find myself saying we need to be cautious here. So, for example, some really good research. You'll see the reference there. Tell me what I want to hear, and it's a nice piece of research which shows that depending on the way in which you ask the question, ChatGPT will come up with more or less accurate answers. And if you lead it in a particular way, you'd like something confirmed, even if what you want confirmed is wrong or inaccurate, ChatGPT will do its best to help you confirm something that was wrong to begin with. So there's some problems in the way in which you pose questions to ChatGPT, and it requires some skill to find the right way of posing a question that allows ChatGPT to do what it does best. So, what we need to do is recognize that these technologies offer great potential. They offer potential to offer highly personalized behavioral advice and allow someone to follow up and to do this all at scale. And it's a really valuable public health tool. But right at this point in time, at this point in the evolution, firstly, the use of generative AI appears to favor those already advantaged in our populations, those with greater education and greater access to resources, including the technologies. The fact of the matter is that it's scraping information from across the internet. So that mirrors existing biases in online information that are cultural, gender-based, age-based, and so on, that you'll find in online information at the moment, and does not discriminate between scientifically valid information and misinformation that's been deliberately shared in online sources. It's also important to bear in mind that a lot of the current potential is about personalizing information, and it runs something of a risk of directing attention away from some of the social and economic determinants of health that will ultimately limit an individual's ability to respond to that personalized advice. And we have to be really careful that we don't take ourselves down into another rabbit hole where we have a new type of victim blaming. So what do we need to do? And I'll try and wrap up in the next few minutes. So what do we need to do to build digital health literacy in the artificial intelligence era? First of all, we need to accept the situation as it is. People vary considerably in their access to digital technology. They vary considerably in the skills that they have to be able to discriminate between scientifically valid and accurate information and misinformation that's made available through these platforms. And people, as we've learned from early research, vary considerably in their trust and responsiveness to what these digital technologies have to offer. What's important going forward is that we take every opportunity to try to build skills and confidence in our communities in the form of digital health literacy, so that the vast majority, rather than the minority, have the ability to find, understand, and have confidence in reliable sources of information through these platforms to inform decisions about their health. Now, what does this all mean? How do we improve digital health literacy? Many of you will be familiar with this model of health literacy, really showing the interface between the person and their skills and ability and the situation in which they're required to use those skills and abilities. I'm sure most of you are familiar with this model. You may be less familiar with this variation on the model. It's something that a colleague, Danny Muscat, and I have been working on for a couple of years to try and understand how you turn a static model that describes health literacy into a slightly more dynamic model which describes what we need to do to change things. And we've identified these 4 areas of intervention. One is improving the quality and reach of health communication. That's mainly about professional development of frontline workers. The second is improving or reducing the demands of the environment. The third is making sure that people have access to accurate and trustworthy information. And the fourth area is working with people to develop their skills and confidence. Nothing too clever in this, but it just moves us on from understanding what health literacy is to understanding how we go about changing things. And that leads us into, well, what do we need to do? Well, firstly, in terms of improving access to accurate, trustworthy digital information, we've a lot to learn from what we've learned over the past 20 odd years. Very good paper written a few years ago now, describing what it takes to build a platform, any form of digital platform, including AI platforms, that are going to deliver accurate, trustworthy digital information. It needs to have features that provide guarantees of quality, relevance, and timeliness of the content. As I said, at the moment, most of the new AI platforms don't have this. They're scraping information as it is from the internet without the ability to discriminate between scientifically valid information and misinformation. They need to be accessible. As I've said, at the moment, most digital platforms favor those who use digital media frequently, younger people, wealthier people. People generally need to have skills to act that make information accessible, understandable, and navigable. And thirdly, we need to use the technology in a way that I think AI will prove to be very useful, and that is to create interactive learning and message personalization. These three principles have been in place for quite some time for the use of digital technology in health communication. Honestly, it's remarkable how rarely they're used to guide the work that we do. We can also work directly with our patients and consumers and community members to improve their skills. One of the techniques we use is this concept of, do you trust it or do you trash it when you find information? How do you understand how to discriminate between different sources of information to identify what's trustworthy? How do you navigate digital platforms to make the most of the available technology? How do you ask the right question of something like Chat GPT? And how do you maintain a sense of detachment about what's provided? You're curious, but helpfully critical of the information that you've got. And this is what we spend a lot of time working with our consumer groups around. How do you discriminate? How do you navigate? How do you critique different information that's available to you? And lastly, we're involved a lot these days in trying to tackle misinformation and disinformation. Some of you be aware of the fact that this became a really big issue during COVID. WHO responded really very well during that time. And now we have a new phase of this as our governments around the world struggle to regulate the quality of online information.
Professor Nakbeem,
yeah.
Can I just gently remind you that presentation time is
yeah,
done.
Sure. I'll try and finish in the next couple of minutes.
Yeah, sure.
Okay. If you'll see, my slide says concluding remarks. So what I want to say is that the generative AI platforms and technologies are already providing, helping us improve the quality and accessibility of health messages. But to realize this potential, we have to be more systematically and critically evaluating AI applications and their use. There's a lot of hype at the moment. People are trying to sell us things, and they're attractive and interesting, but they've rarely been evaluated. And where the evaluations have been done, these have highlighted significant challenges in their usefulness and accessibility. We need to be much clearer about the impact of AI platforms on existing inequities in health and reassure ourselves that they're not actually making existing inequities even worse. And there needs to be, governments need to ensure that there's public accountability for ethical use in different populations and settings. We do need to put into practice what we already know about the use of digital technology for communication. We can work very successfully with our communities and patients. We need to target those who are already disadvantaged first, because those who have advantage will make use of these new technologies, and we have to develop discriminating users of the technologies. I'm not going to spend time on that. If you're interested in finding out more, there's a book on health literacy and a recent paper I've published on which this is based, and we'll pick up questions later. Thanks very much.
Thank you so much for your enlightening talk, sir. I am privileged to introduce our second speaker for today's webinar, Ms. Kavita Nagasampige, who is working as an assistant professor, senior scale in Manipal Institute of Communication, MAHE, Manipal, India. Ms. Kavita Nagasampige has been teaching media and journalism for close to 2 decades at the Manipal Institute of Communication. Before this, she worked as a sub-editor and reporter at Deccan Herald, The Hindu, and Vijay Times for 5 years. During her time in the media industry, she wrote many articles about health information, food, and education. She has presented her research work at various international conferences held in Dubai Norway as a visiting faculty. Her long experience in both teaching and working in media has given her a strong understanding of the communication and editing, making her a respected teacher and professor in the field. Over to you, ma'am.
Thank you so much. Can you see my screen now?
Yes.
Yes.
Can you all see my screen? I mean, just give me a input. Yes, ma'am. Thank you so much. Yeah. So just now, Professor Nadbeen spoke about AI and other things. But coming to Indian perspective and thinking about how media is doing the effective health communication, I'm going to talk about the media front, especially the traditional channels which have been like, very prevalent in the rural areas and other aspects. So moving ahead, okay, the
Ma'am,
rule, yeah,
sorry, your slide is not at the presentation mode.
it is not.
No, it is at the editable mode.
Okay, okay, just a minute. Now,
Not yet.
still?
Not yet.
Oh, okay. I am
Ma'am,
presenting,
in the
ma'am. Presenting.
bottom right,
Maybe you can reshare the slides, please, if possible.
Yeah, yeah, 1 second. Is it, ma'am?
No, ma'am. Your slides are still in editable mode.
But my screen shows.
Can you please share the entire screen
I have shared the entire screen, ma'am.
and the presentation mode, whether it is
Yeah,
on?
yeah, it is in the presentation mode.
Can somebody verify if Prerna,
And
can you see the
no,
presentation?
it is not yet in the presentation mode. It is in
1 minute, ma'am. I have done it. I have 1 second.
Dear participants, apologize for some technical glitch. Please wait. We will sort out this issue.
Now, ma'am? Ma'am,
Yes.
can you
ma'am.
hear me?
Yes, now it is.
Now it is?
Professor Kavita, yes, now it is.
Okay, okay. Thank you so much, ma'am. Shall I continue?
Yes, sure.
Okay, okay. So as I started off with to say that Professor Nadbeen spoke about AI and digital era and all, but coming to the Indian rural perspective and how media has been effective in health communication. So basically, effective health communication is crucial. I mean, in the sense, it has to give an informed decision about their well-being and how, as a media, we do it. See, currently there are a lot of complex medical information in which are like given by a lot of doctors through further different digital medias and the outcome to promote overall community health. We in media give information regarding how the disease has been spread, what are the available resources, I mean in the sense who has given this information to us? When it comes to media, we have to be very careful about our sources. The sources plays a very vital role. Either it should be a doctor, either it should be someone who is from the basic industry, like, primary healthcare center, or it could be the government, it could be the district commissioners or any, and about the precautionary measures that have to be taken. Giving a simple example, if you take our own region, which is the South Canara in Karnataka, we are more prevalent towards a disease called elephantiasis. So here there's a free medication supply every year to the people who want to live with it and, does not get affected by that. So there is some method and measure that is taken with the help of media and other ways to deliver the information, how media does it. So which are the traditional channels or media that are giving out the information? So traditional medias are television, radio, print. So these are basic backbone of the communication from the media perspective. And through this, we promote health communication. These platforms have been giving a widespread reach and the ability to deliver the targeted authoritative messages to diverse audience. See, when I said rural audience, if you see India as a country, there has been a lot of issues when it comes to reaching out to the people, especially the. I am hearing some other voice. So there has been a lot of remote areas where we go. In the sense, in a country like India, there are many villages where, internet does not reach. So certainly radio, television reaches a lot. Many people are not able to read and write. So for them, print may not be a great media, but when it comes to television and radio, it's easily reachable. So television and radio through advertisements have created a lot of awareness, especially effective awareness. When you talk about polio drives in India, when you talk about a lot of vaccination drives, organ donation, other aspects like how to donate blood, what importance it has in the other people, about the healthy behavior, how to live a hygienic life, so on and so forth. So print media, especially newspaper and magazine, is basically for the literate community who can easily read and write. And newspapers and magazines have done a major impact on the people when it comes to given information about the health issues. In the recent past, I would say late after 2008 or 9, community radio have played a very vital role. So when I say community radio, basically community radio's reach is not more than 30 to 35 kilometers. So in this range, what language is spoken? So when we say India, there's a lot of diverse language that is spoken all over the country. So when we are talking about countries' diversity, we need to understand that people should understand in their own language what problems are there in terms of health and other issues. So community radio has played a very vital role in this. So talking about digital and social media channels, see what happened during COVID-19 was many people in our country were very afraid of touching the newspapers and so many other perspectives. So that was the time when digital and social media channels became a very popular platform. In the modern era, digital and social media platforms have become so essential that our target audience are trying to reach to it, but yet in certain region, we are not. They give a lot of information which are vital, yet we need to think whether the information is right or wrong, as Dr. Nadbeen pointed out. From educational videos, I mean, different videos are there today on health, especially in YouTube, Facebook, Twitter, a lot of other areas. So whether are these giving you the right kind of information? Are they delivering the right kind of information? See, when we talk about the traditional media, we have a very controlled, or what we can say is strict law based behind it. But when it comes to digital media, we are still not prepared for the things which may be wrong as a misinformation in the digital aspects. So importance of health literacy in the digital age. So what has happened, how much of misinformation can be delivered. Someone says something is right, someone says something is wrong. So we need to understand by who or which resource the information is coming, whether the information is coming from the right source. That is very essential when it comes to health literacy, especially with the digital perspective. How do we empower the individuals with these health literacy? First of all, give them a knowledge. Knowledge is what is right, what is wrong. But how do you decide what is right, what is wrong? Because we are following certain things. Someone is constantly telling that this is right, someone is constantly telling that that is right. So between the two, how do you decide? So you should know that where or who is advocating the information for the well-being of the people. Then critical thinking about what can happen, why it is happening. Because see, as I mentioned, rural area is one of the major region where, you know, we have to reach to the people. We have to give them an information who does not think, who just blindly believe people and get into the things, or blindly believe the media. Then enabling self-management. This is a very important perspective, because anyone thinks that, okay, I have got an information here and I can consume it or I can take it in. That is not the right thing. So always there is a necessity of intervention by the right source or right individual. So equipping ourselves with skills is good, but not to just experiment on us. And then how to promote confidence. So instill a sense of confidence in individuals. Yes, you can recover, or yes, you can do something good for your well-being. So what is the future? See, when I said about the traditional medium is still doing good with rural areas, but we are expanding in digital platforms very greatly. So as the technology continues to evolve, the future of the media lies in the digital medium. And these digital medium are literally doing very good, hoping that everywhere we are able to cover. And then how much of personalized content we can deliver. So now there is like phone in with a doctor, call a doctor, meet a doctor on a social media, on some other platforms. So all these are there. How well you can personalize the content. Immersive experience. As I said, certain media today have gone, like, you know, certain technological changes have brought in, or certain niche areas have been brought in. Now there are children, there is a separate information delivery for children, there's a separate information delivery for women. So how you can give an immersive experience to the people with emerging technologies, and in the digital way we can make it. And then the most important part is language, especially when it comes to a country like India. Language plays a very, very vital role, because we have a lot of diverse languages. If you talk about Kannada language alone in a state like Karnataka, it is spoken in multiple different ways. The dialects vary from region to region. So in such a situation, how can I give an information which is accessible to everybody? So the key takeaways from this talk, I would say, is how much important traditional media are yet in a country like India, how we can shift from a traditional medium to digital medium with a wise thinking, especially wise thinking. When I mentioned this, I would say that how we take a right information. As I said, there's also a misinformation. We should be very careful. And from the way we have developed, because COVID-19 gave us a very different identity to the digital medium that led to a good way to understand how we can do the thing. So strengthening the collaboration between media, healthcare professionals, and educational institutions is very essential today, especially when it comes to media. Then digital transformations. I would not talk too much about it because Sir has already mentioned a lot of things, but we have to bridge the gap between the people who are yet to receive some information with the help of digitalization. Then empowering individuals, how do we empower them to get into the digital mode to know more and more information? So any questions, any queries? I hope I have done justice to the timeline.
Very good afternoon to all the participants, Professor Nakbeem and Professor Kavita Nagasampingi. Really, both of you have done a wonderful job. It was very enlightening session. So my questions was to start with the Professor Nakbeem. So as we had the sessions on a role of AI in health, enhancing health literacy and effective health communication. So can we say that the AI has definitely enhanced the effectiveness of health communication?
Well, I think I mentioned in my talk that some of the current AI platforms like ChatGPT are really useful tools for those of us who are interested in health communication. They can help us to simplify language. They can help us work with others, particularly clinicians, for example, to simplify the language that they use in trying to communicate with patients, which is often loaded with medical jargon and complex use of language. They're also useful, I think, as I mentioned, for those of us working in more than one language, a very quick way of translating language. What I would say is that we do need to understand a lot more from proper evaluation what some of the challenges are associated with the use of these technologies, and we need to contribute to solving some of those challenges, particularly in the way in which people make use of digital technology, the different use that people make of digital technology. So very useful tool at the moment, not really living up to the hype that often surrounds artificial intelligence, and a journey to travel to bring together the potential and its realization.
So Professor Nakbeem, can you give us some examples wherein if any AI tools have been adopted in Australian healthcare context, so that maybe to ensure effective communication between the healthcare provider and the patients during the hospitalization or post-hospitalization? Do you have any examples? Because each country has their own pace of technological development. So what is what you have seen or witnessed, if any experience, please?
Sure. So we've been using it in a couple of interventions that we've been developing, just simply in order to simplify the communication that we've used with different community groups. But more recently, I've been involved with colleagues in one of our local hospitals who provide information to patients, for example, who have elective surgery, scheduled surgery, and provide information to patients immediately after they're discharged. So information to help prepare people to come into hospital, and information that's essential for them to have at discharge. And I looked at this information and I ran it through one of our systems, and honestly, you need a PhD to be able to understand it. It's written in very complex language, used a lot of medical jargon, was very difficult for an average person to understand, even those with relatively high levels of literacy. So we took that information and provided it to ChatGPT and said again, could you convert this into language that someone at grade 7 would find, would be able to understand? And it did a fantastic job of converting quite complex language for pre-hospital attendance and discharge information. Did a great job at improving access to that information for a much broader population. And whilst the clinician I was working with still wanted some changes to improve clinical accuracy, ChatGPT had done 90% of the job. So we're already using it in day-to-day work to help us simplify complex information so that it's more understandable and accessible to a much broader proportion of the population.
So thank you very much, Professor Natbeem. So my question goes to Professor Kavita. So as rightly pointed out by Professor Natbeem regarding the usage of AI in ensuring the effective communication to the patients. So how can we, maybe in Indian context, can use of these technology in communicating the health information effectively to the large population or specific to the patients in a healthcare setup?
See, basically, I mean, as I stated, that 50% of the rural area is not communicated with network, especially internet and other aspects. And going to AI is a big deal. It's a very big deal. So when we talk about it, we literally need to think how we can go about it. Either we have to set up some centers where, you know, we can tell them, okay, come to this center through which we can give you a lot of information, because AI among the youth is more popular. AI among the universities is popular. AI among the students who are of the current generation who are studying in tier 1, tier 2 cities of our country, it's popular. But when we talk about rural areas, the reach is quite poor. So it's very difficult to reach out. Yes, of course, the only ways is we need to see that we provide some mechanism to reach them and see to it that they are able to access it.
Okay, thank you, Professor Kavita. So can you throw some light on usage of visual tools in terms of ensuring the effectiveness of communication? Can you throw some examples from the Indian context so that our friends or participants from other countries can also have an insight?
Yeah, see, now basically, you know, when you're talking about polio drives, when you're talking about certain health literacy that you have to give to the people, what we are using is we are doing celebrity endorsements. Amitabh Bachchan, if people know who the actor is, a great man in our Indian scenario, comes to deliver an information about it, or some other celebrity is used so that they make an impact on the people. They are the ones who can tell that, okay, organ donation is very important, blood donation is very important. Take your child to a polio booth, get them, you know, injected and vaccinated so that they are free from all the diseases. See, we are in an era where, you know, certain visuals make a very major impact, especially the actors, the people who are idols to them. All these celebrity endorsement in a country like India is very huge, very huge. We believe in it. If they deliver the information, such visuals make a very major impact. And also show the visuals, you know, where people are reaching out to them. Like, for example, people in the railway station, bus stations, they go, they do the delivery of vaccine information and other things. So these are also making an impact on the people. That's how we have been able to, you know, withstand and eradicate something called as polio from a country.
Okay, thank you for your insights, Professor Kavita. So my next question would be to Professor Natbeem. Enlisting the challenges of incorporating or using this AI in enhancing the health literacy. So considering one could be the level of language, okay, converting them the language into a common man's words. Okay, and second one could be networking. Okay, ensuring that people or the consumers do have access to the network and technology. And the third one would be like the information which is available, okay, online, whether it is useful or from which source it has come from. Okay, apart from these three, are there any major challenges observed in terms of using AI or technology in improving the health literacy of the population?
Yeah, a couple of others that that I spoke about. The first is that AI, as it currently operates, particularly the large language models, is dependent upon the source information available to it. And at the moment, most large language models are simply using unfiltered online information. And the problem there is that some of that is scientifically valid and accurate. Some of it is not. It's people's opinions and ideas. And some of it is deliberately intended to mislead people. And at this point in time, there's no simple way in which we can verify the usefulness of the information that these large language models will throw up in answer to a question. So there's a clear challenge there in trying to work out how we use the technology successfully to get all the benefits, but actually protect consumers from misleading information, some of which is unintentional, just people's ideas and opinions, some of which is deliberately designed to influence people. And there are ways of doing this. You can develop an algorithm, for example, that limits the sources of information that are used to develop responses. But at this point in time, that's not being widely used. As I said, people are promoting the use of AI, often in order to make money, without there having been proper scrutiny and evaluation of any part of it, actually. And that's my concern. I'm not, I'm quite enthusiastically using the tools that are available now, but I do so as a reasonably well-informed consumer. The problem is most people are not approaching it in that kind of a way, with a high level of skepticism and some familiarity with the strengths and weaknesses of technology. So we've got to work with our governments to try to improve the quality of the information that's available through these platforms, and we have to work with our consumers to make them more skilled users of the technologies as they emerge, basically. And it's always going to be a bit of both, trying to make the platforms as useful as possible, trying to ensure that consumers are able to engage with them as safely and successfully as possible.
Thank you, Professor Natbeem. Your session was very insightful and the discussions very interesting. I think due to the time constraint, the organizers are asking for okay, so to conclude today's discussion, so hopefully I think we can have many more such sessions so that we can exchange the views, experiences, and ideologies across the countries, and we can make use of this platform, I think. Thank you. Professor Kavita, thank you very much for your insightful answers and sharing the examples from Indian context.
Thank you. Thank you.
Over to you, Prerana.
The panel discussion has ended, bringing us participating in such a fantastic event on behalf of MHLU has been an honor. I want to extend my heartfelt gratitude to our esteemed speakers, moderators, faculty, staff, students of MAHE, and members of MHLU Executive Board. Ultimately, I extend our heartfelt thanks to Dr. Sherian Verghese, Director of Prasanna School of Public Health, MAHE Manipal, MAHE Press, and Media Administration, and all the support we have received. Thank you.
Thank you, everyone. I request everyone to please put your camera on, and so that we can have a group photo. Let me change the setting, how we are visible. Yes, I think this looks good. So we have people around the globe with us working together for health literacy. And that's such an amazing thing to see, that we all have a common goal. We all share the same passion to do something for our society. Thank you so much for being here. It really means a lot. We'll be having a next webinar next month, and we'll request you to please join and share this information with all your colleagues. And even if you want to request us to host a speaker, do let us know, and the topic. We'll be happy to provide as much as possible. This platform is for all, not for only Manipal Health Literacy Unit, but it is for all of us. Thank you so much for being with us, and we have taken a photo. Thank you, lovely audience.
Thank you, one and all.
And special thanks to Professor Nutbeam. I know, I was a little scared that, whether you'll be able to join or not, but I'm very glad, even despite of your constraints, you joined here, and valuable insights that you shared with us will lead to future research in this area. Thank you so much, sir. And thank you, Kavita ma'am. Yes, your presentation was lovely, and especially from experience from a newspaper editor. Coming here and sharing your insights with us was remarkable. Thank you so much.
Thank you. Thank you so much.
And thank you, Swati ma'am, for moderating the session. And thank you, Prerna, for such a lovely emceeing the session. Thank you.
Always